The mantra that many people use is do today's work today. If a patient calls today and wants to be seen today, try and get him in that day to be seen. For many, many years, I ran my scheduling system in a traditional way most physician offices did, which was to fill up the schedule with as many appointments in advance as possible. As I made a change from being a full-time clinical practitioner to a part-time one, I realized that in order for my patients to have adequate access to the limited amount of time I was in the office, I needed to change the way I did scheduling so that they would be able to get in when they needed to be seen. In Massachusetts, where as we've gone through healthcare reform over the last 2 to 3 years and have been able to provide healthcare insurance coverage to almost the entire population of the Commonwealth, we found that demand for primary care has really grown. So balancing our supply of physicians and availability of time of those physicians with the demand of a increasingly insured population has been a very important part of why we've gone down this pathway.
Yeah, you know what, I'll take them with me.
That actually takes a tremendous burden off the staff as well. They don't have to look at a schedule where there are no openings, no places to put the patient. Instead, they've got room to have patients come in and be seen. So, come on in and have a seat. From the patient perspective, once they arrive in the office, since they're not being squeezed into an already overbooked schedule, more often than not, they will be able to be seen quite soon after the time that they arrive, so that they're not wasting a lot of time sitting in the doctor's waiting room. One particular group of patients for whom I think there's been a little bit more resistance around this tends to be my senior patients. They are the patients who have the multiple chronic medical problems and often need closer follow-up, so they want to know exactly when they're going to be coming back to the doctor's office. Other than that, I haven't seen a lot of downside to this kind of an appointment scheduling system, and I'm hoping that as we move forward in the future, we'll continue to refine this and make it work better for both the patients, the staff, and for me.